Good evening, everybody. Welcome to Bris Science. My name is Joel Gilmore. I am your MC for this evening, and it's so exciting to be here. If this is your first time, welcome. Bris Science is a series of free public lectures on science presented by the University of Queensland. We're once a month here at the fabulous Edge at the State Library of Queensland, and we aim to bring not just the best scientists, but the best communicators to share their research and their passion for science with Brisbane and the world, everybody watching on YouTube at home. I would, of course, like to start by acknowledging the traditional owners of the land on which we're meeting tonight and pay my respects to elders past and present. And of course, when we're talking tonight about caring for all the wonderful fauna of Australia, it is something that caring for the land was a huge part of the First Nations culture in Australia, and we are still learning from their insights on how to care for this wonderful land we all now live in. So tonight, we have an incredible speaker. A little bit of housekeeping first of all. We're going to have a presentation, after which we're going to take questions from the audience. We do that using our app, our QR code you can see here. So if you've got a smartphone, you can scan that now, and that will take you to a form. And we'd encourage you to ask your questions during the talk or at the end, after which I will go through as many of questions as possible. And if we still don't get through all the questions, never fear. We would love for you to join us out the side there for some food and drink and a chance to speak with Bob and with yourselves about what we've discussed tonight, because science should be a community activity just like anything else. It doesn't just have to be about the Olympics this week. Although, you know, I'll understand if you're checking your phone occasionally. That said, I would love you to put your phones on silent now. There'll be no need to phone a friend during this particular talk. All right, so tonight's speaker, we have a very special guest, Professor Bob Donnelly. Bob graduated from the University of Queensland actually back in 1982. He then worked in veterinary practices in Australia and around the world before setting up his own clinic in Toowoomba, where he ran his clinic for 30 years. Finally, though, he made the right decision and has joined the University of Queensland out of the UQ Gatton campus as a professor and head of the Avian and Exotic Pet Service. And tonight, he is going to share some of the incredible advances that we have seen in animal science and some of the exciting new developments. So could you please put your hands, flippers, or wings together for the incredible Professor Bob Donnelly.
Well, thank you all very much for coming along tonight. I know you wanted to stay and watch the Olympics, or have a nap, or do both at the same time. Yes, I'm very pleased to see some of you who are just curious to know what you're doing out on a Monday night when you could be at home having a quiet ale or a glass of wine. But anyway, that's not my importance. I'm here to talk about what I do for a living, and I've been doing it for a long time. If you see me shaking, it's not because I'm nervous, it's because I have Parkinson's in the early stages of it. So if I forget what I was talking about, that's Parkinson's. But anyway, I'm getting through it, or over it, or along with it. So often I have people ask me, what do you do for a living? And I always sort of shy away from that because it becomes too long and too complicated a question. People say, you know, what do you do? Oh, I work at Gatton. And that straight away, you know, you're a potato farmer. They're not really interested anymore. But if they push me, I finally come out and say, yes, I'm a vet and I teach vet students and I treat animals. And they say, oh, what sort of animals do you treat? And that's when it gets to, you treat what? Okay, I haven't touched a dog or a cat other than to pat it for about 10 or 15 years. And I've eaten a few cows, but I haven't treated that many. And I don't have a very good success rate with horses. No questions about horses. Okay, so we always talk about, you know, real doctors. My mother was a nurse, my father was a doctor, he died when he was very young. But my mother always used to say, are you a real doctor? You know, real doctors treat patients like this. And I would say, well, you know, real doctors actually treat much more than one species. Medical practitioners, they're just treating one. Okay. Whereas these guys, I laugh at these guys, you know, a large animal vet, horses and cows, wow, that's a lot. Small animal practitioners are even worse, dogs and cats. Okay, real vets treat more than 9 species. Okay, and this is why my head is always such a clutter. I'm never really sure what I'm doing. And I've seen all of these species, even a chameleon. I've treated chameleons. There's a whole range of different things that we see keep us very mentally agile at times. We have a saying that in veterinary medicine, small animal vets treat disease, whereas exotic animal vets discover it. And I've been involved in the discovery of 3 or 4 different viruses and a couple of new disease syndromes in birds. And what I'm really happy about is passing that on to the next generation of young vets that are coming through. Okay, so how did I come to get into this sort of a field? I graduated from the College of Knowledge, as we used to call it, vet school out at St Lucia back in 1982. For you young fella, mate, that's last century. World was still flat back then. Dinosaurs still roamed the earth, but they didn't go to vets. So we had 2 lectures on bird medicine by a guy by the name of Charlie Prescott, brilliant guy. He had been a vet student at the start of the Second World War and left vet school to join the Merchant Navy, did the Arctic convoys, and then came back and finished off his vet science. We know this because he told us all about the Arctic convoys in every lecture. So when he gave me 2 lectures on bird medicine, it was actually the same lecture and he gave it twice, he forgot. He was a top bloke. I graduated, I wanted to be a dairy vet, not because of a particular fondness for cows, but because at that stage there were folks like Don Kerr who were developing herd health as a module of animal medicine, not so much looking at the individual health, but the health of the whole. And I found that particularly interesting. Unfortunately, that didn't translate into practical reality. I did graduate at a time when there was a shortage of jobs, and my first job was up in Bundaberg. I moved up to Bundy and working for a guy called Fred Bronson. He's long retired now, and that sign wasn't there when I was there, but that's what it looks like now. While we were there, the local budgie club asked Fred to give a talk about bird diseases. So Fred did what you do in that situation. You're the new graduate, you do the talk. So I had to go and read up on it. There was 1 book in the practice about bird medicine and a set of conference proceedings from a conference in 1981 down in Sydney, and I started reading. I thought, this is bloody interesting. And I became more and more, and I've just followed that, what's called in the veterinary science world, the goanna track to success. I've just been moving around, accumulating different bits of knowledge as I go along. So that talk to the Bundaberg Budgie Breeders Association was a turning point in my life. Not the turning point, a turning point. The turning point was meeting my wife there. I got married up in Bundaberg, and that was in 1985, so we're coming up to 40 years. And we have 2 wonderful children. Our son is a lawyer, so I'm sorry about that. He graduated with a degree in international business at the height of the global financial crisis. And so his timing has never been really good. What made me very proud was that he just said, oh, well, I can't get a job in business, so I'm going to go and do law. So he went straight back to university without breaking step and ended up as a lawyer doing contract law. My daughter, on the other hand, she wanted to be a lawyer. And so she started doing law, and she said, oh, I want to do a job that helps people. And I don't see how charging $400 to write a letter helps anybody but my boss. So she quit law and she did a double degree in criminal justice and human services, I think it was, and was accepted into the Federal Police and has just been promoted to sergeant. So 2 very clever children, and all down to my lovely wife, Marie. My wife does many things very well, but retiring is not one of them. She's tried about 4 times in the last 5 years, and now she's working full-time as our daughter's babysitter. We have 2 grandchildren, 4 and 5, and they keep her very, very busy, and I try and hide and pretend I'm not there. There are some small people around, I'm vaguely aware of them. Okay, so how do I get into avian exotic medicine? As I said, you know, Bundaberg Budgie Breeders got me into it. And I started becoming more and more involved. In 1988, we started our own practice. We bought a house up there, converted it into a vet practice, just like everybody else does. And we treated everything, dogs and cats. I'm one of the few people who can claim that I successfully vaccinated myself for tetanus while I was vaccinating a mob of sheep who had tetanus. Another reason not to do large animals. I got my membership of the college. The Australian and New Zealand College of Veterinary Scientists is a non-government body. It's not part of the university. It's an independent body that assesses people's progress through their career. And one of the first things you can do is become a member of the college. But to become a member, you've got to have been in practice for 3 to 4 years, and you have to be working predominantly in the field that you want to gain your membership in, and you have to pay them a lot of money to sit your written exams and your oral exams, and once you gain that, you're a member of the college. After you've done your membership, the next step is to become a fellow of the college, and the fellow of the college requires doing a residency or directly supervised training over a long period of time, publishing papers, doing all sorts of things. And I finally managed to achieve that in 2003, which involved a lot of travel overseas, leaving my wife to look after the kids. I have not yet been forgiven. So I try to live with it. But I was registered as a specialist in bird medicine. I was the first one in Queensland and the third one in Australia. I always say I'm the third one in Australia because Shane Radel from Charles Sturt University did his exams at the same time as I did, and I point out to him that Donnelly starts with a D and R, Radel starts with an R, so alphabetically I'm third and he's fourth. He's actually mature enough not to care. Okay, then in 2010 I was starting to get a little bit burnt out. I was starting to get a lot burnt out. And a wonderful man by the name of Grant Fraser came along and asked me, would I like to come to UQ and become the head of the small animal hospital? And I said, well, what's the hospital consist of? And he said, I've got a concrete slab so far. And so that was enough to convince me. Grant was one of these very charismatic people. If he asked you to do something, you'd just say, well, how high do you want me to jump? And so we sold the practice and still living in Toowoomba but commuting to Gatton. I started there. That's what the clinic looked like back in 2010. And I remember discussing with Grant about all these bottle trees that they'd planted out the front and would they ever survive. And now you can't see the front of the hospital with these massive bottle trees that are there. So he was a man of the future. So I started there, and then over a period of time there was various sideways steps, upward steps, backward steps. Anybody who's been in the university knows what that's like. It's like the army, only it's not organised. But I ended up as head of my own service, the Avian Exotic Pet Service, which I might add I invented. It wasn't part of the university at that stage, and I just said, I'm head of the Avian Exotic Pet Service. And they said, oh, okay. And then a couple of years ago, they made me a professor. I think it's probably because I turned up wearing a coat and a tie for the interview with the flu. I'm pretty sure I didn't have COVID, but I'm not 100% sure. But nobody died at that interview, and so I'm pretty confident that I was okay. So I've been teaching there ever since, and now I'm nearing the end of my working life because I've got the shakes too much. I can't do surgery much these days. I do it in an emergency, otherwise I get young people with good eyes and good hearing. I've got hearing aids, glasses, and the shakes. What's wrong with that? So what sort of animals do I treat? Around there's a wedge-tailed eagle. We've got him hooded so that we can restrain him. He's got a broken wing. That's just one of the birds I treat. That's a blue and gold macaw. That's an opaline mutation. So the blue and gold macaw should be blue on the black and yellow on the front. And this is a very rare mutation. Stunningly beautiful bird. And I'll show you another colour mutation in this species shortly. Canaries. Don't see as many canaries as we used to see. I think the little old lady sadly died out. They were the pet for little old ladies. You do a house call to go and see the canary. And just to put a bit of pressure on you, this was the last thing she has that her husband passed on to her just before he died. Man, that is pressure. I've had people say this is the only one of its type in Australia. That's a bit of pressure. This being the last thing my husband gave me just before he died, that's pressure. Really puts you under the gun. So I like the little canaries. I did a lot of work with ostriches back in the days when the ostrich industry was going around. 3 cracked ribs, couple of winded a few times, but by Jove I learnt herd medicine, incubation, chick rearing, growing animals out, making decisions as to whether to treat the individual or the herd. There was a whole lot of work involved in that, and I was really good at catching ostriches. I went to a farm one day and I was the only one there. The wife was there to show me where the ostrich was. She's 8 months pregnant. I'm thinking, you're not going to be any help. Where's your husband? Oh, he's at work. Oh, okay. And she takes me to the pen, and it's a slight slope to it, covered in rocks, full of trees. And I'm thinking, how am I going to catch this bird? And as I was thinking that, it walked past me. And so I grabbed its head, pulled the head down, pulled the hood over the top of its head, backed it up against the tree, and kept talking as if this is how we always do it. And I'm sure that to this day she thinks it's very easy to catch an ostrich. I will say one thing for ostriches, people really like their hide. Really good meat. You eat these guys, it's a low-fat meat, and there was a bakery in Toowoomba that used to make an ostrich in red wine pie. It was so good, I rationed myself to 1 a week. It didn't help. So, little like a baby African grey. Technically, it's not an African grey. Technically, it's a grey parrot. It comes from Africa, but everybody calls them African greys. And that's just a little baby in one of my clients' aviaries. A couple of chooks I saw the other day. These are Polish chickens. That is super cool. The one on the right is a frizzle, just meaning the feathers are fuzzy. And I sent my wife this photo and she said, I'll have 4. So we have to get some of these now. But these are unbelievably cute. And they were sitting on the owner's shoulders when she came in. They weren't just egg layers. We see a lot of wild birds, baby tawny frogmouths. I don't mind seeing these guys because I don't have to do a lot with them. I check them over, make sure they're okay, pass them on to a carer, and never know what happened to them. That's the sad part of doing wildlife medicine. You either euthanize it or it goes to a carer, and if it goes to the carer, you never ever find out how it went, or rarely find out. Kingfishers, hate kingfishers. Beautiful bird. If you can't release them within 24 hours, don't try treating them. They just don't handle being hospitalised. Beautiful birds to examine, but yeah, you don't want to play around with them too much. Boobill owls. Actually, that's a powerful owl chick. Took that photo out at Alice Springs and Galahs. Who knows what that one is? Believe it or not, it's a rainbow lorikeet. So that's a pied mutation of the rainbow lorikeet. It's weird things out there. When people are breeding these animals for fun and money, once they've sold enough birds into the pet trade, then they have to start breeding for colour mutations to sell them to somebody else. And so they're selling them within their own circle. And the first Lutino scaly-breasted lorikeet was a wild-caught bird down in New South Wales, and the kid who caught it sold it to a breeder for $20,000. This kid was 12 years old. Man, I wish I had a profit-making scheme like that one. Reptiles are always fun. A friend of mine once said they're just birds without feathers. They're a little more complicated than that, but not a lot. They do all sorts of things. We see little dragons. That's a little pygmy bearded dragon. This is Pagona Henry Lawsoni, named after Henry Lawson. What the hell has Henry Lawson got to do with a bearded dragon from North Queensland? I've no idea, but it's named after him. They'll fit in the palm of your hand. Green tree python, Morelia viridis, beautiful animal, will bite you, long teeth, nasty nature. Not something you want to get too close to too often. Little short-necked turtles. This little turtle would follow the owner around the room. When she was standing beside the table, he came up, walked up beside her and put his head out and looked up at her. And people say, oh, it's just a reptile, they don't have feelings. Yeah, I sort of changed my mind that day. The blue-tongued skink, we tell people they're skinks, not lizards. And that's only to remind my students that if you pick them up by the tail will fall off. So, because it's a skink, but there's a lot of these guys being kept as pets all around the world. Frill-necked lizard, very different from the bearded dragon. They're not very good pets, but a few people keep them for hobby. Taipans. I've treated a few taipans in my time. I have successfully avoided being bitten by them, which is more than I can say about the owners. The guy who owned that particular taipan got bitten while he was giving it antibiotic injections at my direction. So I sort of felt bad about that. And one of the cool things we do is every year we get lots of turtles coming in that have been hit by a car. And if they're badly injured, the shell's shattered, then we'll take a radiograph and we'll see if there's eggs in there. And if there is, we'll euthanize them and do a caesarean. We get the eggs out and we incubate them. And so mum might have died, but we might have 20 little hatchlings that we can then release in her place. So that's a little broad-shell turtle hatching. And the X on the shell is just to tell us what side it's been rotated on. Okay, what else do I treat? Little mammals, the small furries. Pet rats. Rats make great pets. Who's owned a pet rat? They are great pets, aren't they? The really good thing about them is they don't smell. Mice, on the other hand, mice stink. I can walk into a bird aviary and tell you if there's a mouse problem just by sniffing the air. Okay, but pet rats, we see a lot of them. They used to all come in with a goth, but now it's more normal people that have them. Not saying that goths aren't normal, just saying that they're very stereotyped as far as pet selection. Little rabbits, we don't see rabbits in Queensland. It's illegal to treat a rabbit in Queensland. No, it's not illegal to treat them, it's illegal to own them. I don't own a rabbit, but I do treat a few. Guinea pigs are my favourite furry pet. These guys are wonderful, and I've yet to eat one, but it's on my bucket list. I don't believe in treating anything you're not prepared to eat. So, but I just love working with these guys. If you want some quiet time, just pick up a guinea pig and sit in a quiet corner, and both of you will go to sleep. It's really relaxing. No, mice. I always tell people that mice smell, and they do. Mice also always come into your consultation room with a 12-year-old girl and her father. Her father's already angry because he can't believe he's spending money on a mouse. And I say to the students, you just watch this, guys. If you make that little girl cry, he's going to make you cry. So treat that mouse with a lot of respect. Ferrets are also illegal to keep in Queensland. It's also illegal to treat them. If I have a ferret come in with a Queensland address, I am obliged to report it to Queensland Biosecurity. If it's got a New South Wales address, that's different. We get a few that are referred from New South Wales, from vet practices in northern New South Wales. We're quite happy to see them, so long as we know that they're going back to New South Wales. Ferrets are a very interesting species. Cat with no legs, or a slinky. They're incredibly agile, and they smell a bit. Yeah, they're very smelly. But I quite enjoy working with them, but I probably see 2 a year. Does anybody want to hazard what the fine is for owning a rabbit or a ferret in Queensland at the moment? Sorry? 20,000? No, it's gone up. $40,000. So when they said that, I said, we can't see Queensland ferrets in the university anymore because I don't think the university would pay the fine if I was charged with owning a ferret. Pretty sure they wouldn't pay it. So what else do I treat? We get a lot of wildlife coming in. We get lots of koalas out in Gatton. It's a real koala area, and we'll see them hit by car, hit by chlamydia, hit by dog. We had one last year that came in. 2 dogs had treated, and the owner saw the dogs barking at the koala in the tree and went back inside because she was confident the koala wouldn't come down. Didn't bring the dogs in, left them out there, and when the koala finally came in, they ripped into it. We were able to save it, but just a little bit of common sense when you're working with guys like this. The other thing with koalas is that they bite, they scratch, and they smell. You know, they're not nice animals. Pygmy possums, on the other hand, are ridiculously cute, but you've got to hold them very carefully because they're very quick and very small. You're not going to catch him if he gets away on you. So you usually anaesthetise these guys to have a look at them. Echidnas are just fun to take an X-ray of. You get this big bundle of spikes and they look really cool. And we see a fair few of these. And in fact, my senior nurse, Beck, was collecting echidnas at one stage. We would have all these echidnas brought in, and she and her husband own 10 acres of land halfway to Gatton, between Gatton and Brisbane. And so she would, 100 acres you've got. And any koala that was fit for release, any echidna that was fit for release, she'd take it home and just let it go on her block of land. And when she got to 10, she thought she should probably stop, but she didn't. But interesting, when I asked her, have you seen any echidnas around your place? She said, every now and then I see one. I think you've got a herd roaming around there. You know, where'd they all go? Skivvies, we see a lot of skivvies, ranging from little pink joeys through to full-blown adult greys with a compound fracture of the leg after being hit by a car. They often come in the boot of a car, and we euthanise them in the boot of the car. I've done a bit of zoo work. These are 2 lion cubs that have come in for vaccinations. I knew these guys fairly well. I delivered them by caesarean. So once a vet from Zimbabwe once asked me, have you ever done a caesarean on a lion? I said, yes. And it just took the wind out of her sails. I had nowhere to go after I said yes. So yeah, I was vaccinating these guys that I had delivered. And I've even played with tigers. And do you remember the old RSPCA ad with the jaguar with a little shortened tail and a little bandage on your tail? Yeah, I euthanized that one. That was a zoo animal, the most placid, gentle animal you could ever meet. But she was 25 years old in complete renal failure and in a lot of pain and suffering. So I didn't feel bad about euthanizing it, but I thought, well, the RSPCA can't use that one in the ad. So, but the big cats, they're fun, they're interesting. A zookeeper once told me, he said, I prefer lions to tigers because a lion will always tell you what it's going to do, and it's always going to try and kill you. A tiger will pretend you're not there. He'll pretend that he hasn't seen you. He'll sneak around the back, and then when you least expect it, he'll kill you. So they're always fun. And we see a few rarities. There's an albino koala. And just last week I saw an albino or a leucistic yellow-tailed black cockatoo, completely yellow bird. So we see a few odds and sods. This poor old guy, he was in severe kidney failure, and it was a genetic combination that gave him the colour but also left him with very badly diseased kidneys, and we weren't able to save him. But he was completely white. So here's some statistics about pet ownership in Australia. Now these are based on stats that were collected in 2022 by Animal Health Australia, and they only do it every 2 years, so the 2024 stats aren't out yet. But back in 2022 there were 6 million dogs owned. There were about 5 million cats. There were nearly 4 million birds. Small mammals, only about 500,000. Reptiles, a bit less. Everybody's got a goldfish. Fish. And there's only a handful of fish vets in the world. And I don't pretend to be one of them. And then you get the others. These are people. There are people who keep insects. You know, someone says, what's the most unusual animal you've ever treated? Say, scorpion. And what did you treat it with? And it was the only thing in the book about scorpions. They can get stuck in malt, just increase the humidity. So there you go, I did that and he got better. Apparently they only have one disease. Okay, why do people keep these guys? Well, some people keep them for relaxation. You know, with a guinea pig snuggled up in a corner. Very gentle, very quiet, very peaceful, relaxing. Low maintenance. That's 21% of people think they're low maintenance. Wow. Okay, the turtle is the most high maintenance pet in the world. Much harder than keeping fish alive, and you saw how many fish there are. There are lots of fish because they're based on sales coming out of pet shops. And they're always go home, die, get replaced. Punches the numbers out there. Turtles are really hard to look after, and that's just the tip of the iceberg. Companionship, particularly during COVID, we saw the number of exotic pets going up astronomically because people found if you're living in a small unit, you've got nothing to talk to except the TV. Maybe it's time to get an exotic pet and you don't want a dog because you can't take it for a walk because it's COVID. Then we saw people with birds, reptiles and all sorts of things. And people were very keen to get into it because going to the vet was an excuse to get out of the house. So vet visits went through the roof. And as a hobby, there's a lot of people who keep these guys and breed them as a hobby. Some of them are, the old bloke who breeds cockatiels in his backyard, sends them down to the Sunday markets. And then you get the high-end breeders breeding blue and gold macaws. Not so much the blue and gold, they're only worth about $4,000 now, they're very cheap. But you get a Lutino blue and gold, and you're talking $80,000. So, or as one of my colleagues, Professor Ben Ahern, says, that's horse money. He treats horses. Okay, so what kind of work do you do? Well, basically it depends on what owners let me do, what they expect me to do, and what they'll allow me to do. So a lot of my work revolves around preventative health care. And it helps when you're working in a university because you're educating not only the client but also the students. So you feel that you are passing something, I call it the ripple effect. If I make a little wave now, it's a ripple that'll spread out and benefit animals all around the world. Because I teach a lot of international students. Okay, so there's a Lutino blue and gold macaw. That's not a bad specimen. I've treated several of these. I couldn't afford one. But yeah, we've got two clients who breed these. And we've got I know a vet in Germany who wants them. And he's trying to get me to set myself up as a middleman. And I've tried, but people don't want to sell them yet. So they're out there, but we also get people little pet rat. Okay, they bought $15 at the pet shop. Means just as much to them, probably more, than the owner of the blue and gold macaw. The owner of the blue and gold macaw, that's a business model. That's not so much a pet, not a companion, it's an investment. This is a little mate. Going to sit on my shoulder. Okay, so we do all sorts of things. We do health checks, we do pre-purchase, post-purchase exams. Somebody once told me that he wanted me to do a health check on anything he was buying, but not to do health checks on anything he was selling. Okay, I think that's a compliment. Sex identification, that macaw there, is it a male or a female? You can't tell just by looking at it. Okay, you can wait till it starts laying eggs. That can take a minimum of 5 years and could take up to 10 or 20. You could surgically sex it, anaesthetise it, make a small incision on the side, pop an endoscope in and examine to see whether there's an ovary there or testicles because they're internal. That's something we used to do a ton of. I used to do that every week. But now DNA testing has arrived and we're doing all this DNA testing. And it's much easier, but it takes a week or so to get the results back. You'll see DNA testing advertised as 99.9% accurate. Who here has got a background in any sort of biological testing or any sort of experimentation? There's no such thing as an experiment that's 99.9% accurate or a test. It just doesn't exist. But it's good to put it on your advertisements. Nutritional advice, I spend every consultation on talking nutrition because most people still think that bird seed is a way to feed birds. I work on the basis there that if I plant it I should get birds, but it doesn't work that way and it's a really unhealthy diet for them. So we keep working against that. And I've got their grooming. Why would you do grooming? You'll see a bird in the moment that I do some grooming on. And it's a different sort of grooming from what you might expect to see down at the local grooming parlour. We do treat the sick and the injured. This is a sulphur-crested cockatoo that had a hernia and we're just repairing her hernia. These guys get hernias because they become reproductively active. The ovary and the oviduct inside become very large and that increases the pressure within the body and they pop a hernia. Usually because they're very unfit, very overweight and very old. So when we're repairing that, we have to remove the oviduct at the same time. So it's not just a simple nip and tuck. It is actually quite a challenging surgery. We do a couple of those every year. Guinea pigs, this is a little guinea pig with ovarian cysts. So she's got active cysts on her ovaries, they're producing oestrogen and that's causing her hair to fall out. Once again, proving that oestrogen is a toxin. It's very poisonous and should be avoided at all costs. When ferrets and lions come into season, if they're not mated, they will stay in season and continue to produce oestrogen until their bone marrow fails and they die of anemia. It's a poison. Carpet snakes come in with lumps and bumps. Sometimes the lump is inside. We had one come in with a lump and we took an x-ray and it was a rat. The animal had escaped and it was found under the owner's couch. And fortunately they didn't have pet rats. This was a wild rat that they didn't know they had. But this one was an abscess, in a bite inflicted by another snake. Dentistry in a wombat. We get wombats coming in from a zoo. They come in twice a year for a health check, and we usually have to trim their teeth because, like guinea pigs and horses, the teeth grow continuously, and if you don't trim them in the wild, they trim them with their food. Very difficult to provide a natural diet in a zoo environment, so we trim these guys back using a high-powered dental burr with a really big burr on the end of it, and we trim them back. So that's a challenge, getting a wombat on a table. That's a challenge. They're heavy. That's like 20 Besser blocks. And then trying to anaesthetise them, not too bad. Trying to intubate them, that's really hard. Gary is my senior anaesthetic tech. Gary, intubate that. And I take a photo and say, this is a wombat I intubated. And that's a dental gag there. That's a dental gag and cheek pouch spreaders, so that we can actually access the mouth and have a look and see what's going on in there. We call that the ancient medieval torture device. We call it the rack. Isn't that a beautiful colour? That's that opaline blue and gold macaw. Okay, orthodontics, birdie braces. Okay, this is something I learned how to do this back in the 2000, I think it was. I learned how to do this over in the US. And a few years ago we had a real run of them. We saw about 40 in a year. And so we were doing quite a lot of these. And this is where you get what's called scissor beak. And if the beak starts to grow in an abnormal direction, usually because some sort of injury to the bones in the skull, and if it's injured on one side it stops growing and the other side keeps growing, and you end up with the beak going skew. And so if you look there, you can see we draw a line between the nares, the nostrils, and then the perpendicular bisector, drop that out, and we can see how it's starting to turn, in this case turning to the right. So you can see it's a fairly obvious turn in that little guy. If you don't do anything about it, that's what you end up with. This is what I talk about grooming. This is the sort of grooming I do. This guy comes in for a beak trim. That's a full anaesthetic and about half an hour to an hour shaping that beak with a Dremel. So there's nothing simple about the grooming that we do, but this guy gets into trouble where he can't actually eat if that beak overgrows enough. So I've got to do something for him, and it's too late to fix it because he's now an adult. So this is another one. This is a 12-week-old blue and gold, and he's starting to twist over towards the left. So we're going to do a procedure on him called a transsinus pin. We just call them birdie braces. So the first thing we do is put a pin through his skull. Now, everybody thinks I've just gone straight through his brain. Blue and gold macaws don't have a brain. It's actually gone through his frontal sinuses. So it's nowhere near his brain. I suppose it is close to his brain, but it's not touching the brain. So we put that through, and we've got to line it all up because it's got to be at right angles to everything. And we take that pin through. And once we're satisfied that we've got it through, we'll bend it over. So we bend it over where it's coming out of the skull there, and we're going to run it down so it's just slightly off parallel to the beak. Okay, and then we hook all this stuff up. That is the stopper out of a vacutainer, a blood collection bottle, and that's there to stop that pin pulling through. The pin is bent over and it's got a cap on it, also to stop the pin pulling through. Down here, we've brought that pin down here and then bent it and put a cap on it. And then we've connected that pin to the beak, usually with rubber bands, but sometimes I drill a hole in the beak and put some stainless steel wire through it and just basically tie it to it. And so we end up with braces on. And these guys can eat with that on. They do quite well. And that's what he looked like 3 weeks later. We draw our lines and he's nice and straight again. The older they are when we do it, the longer it takes. I've had some correct within a week, and I've had some that haven't corrected in over a month. Often if they're not correcting in over a month, it's because the owner's not keeping a close eye on it and don't come back for rechecks. Okay, we also do some work with reptiles. This was a fun one. This is a little tawny dragon. They come from out in Central Australia. 2-year-old female tawny dragon, and she's presented because her belly is a bit swollen and she's straining a bit. What could it be? She weighed only 22 grams. You know when these people go on about doctors doing surgery on a baby and how wonderful it is that they can operate on a patient that small? I wish mine were that big. So she weighed 22 grams. And we're thinking, okay, what's going on? What's wrong with her? Okay, so what could it be? It could be fat. She could just be a fat lizard. It could be fluid from liver disease, heart disease and infection. It could be gas in the intestinal tract. We see that occasionally. It can be air. Sometimes because they don't have a diaphragm, if they get a ruptured lung, the body will fill up with air and they develop what's called a pneumocoelum. Or it could be an enlarged organ, so say a big liver, for example. Don't know what it could be at this stage. Eggs is another possibility. So she's a little bit too small to do much in the way of diagnostic testing. Physical exam, she's as big as my finger. I have big fat fingers. My nurse always says to me, you have the largest hands in the hospital and the smallest patients. How does that work out? It doesn't. Okay, so too small for a physical exam. Blood tests? No. Try finding a vein on that little girl. I mean, I collect blood from almost anything, but the only way I'd be able to get blood from that little girl would be directly out of her heart, which would probably she'd survive, but I wouldn't get enough blood volume to do a test on. It would just be an interesting exercise to go through. Interesting from my part, not from hers. A radiograph, taking some x-rays, if it's 22 grams, it's just going to be this grey blob on the film. You're not going to be able to tell much from that. So what we did was do an ultrasound. That's not her. That's a bearded dragon. Okay, we do a lot of ultrasonography on these guys. Now these are her ultrasound images. So this is what we call a sagittal view. We were looking at down the side. It's a side view. And there's very obviously an egg sitting there in a tummy wanting to get out. So sagittal view is nice. Okay, so you've got an egg there. Better take a axial view. Oh, she's got 2 eggs. Okay, so what do you do in that case? You go to surgery. We did a C-section. This is not her. When you're doing something that's 22 grams, you never remember to tell somebody to take a photo. So this is actually a bearded dragon with a blocked gallbladder. And we're opening the gallbladder and relieving the obstruction. But it was the only photo I had of something that looked like an egg. It wasn't in a snake. So there she is. Once we finished the surgery, she did well, and I could remember to take a photo. We use these little wiggle band-aids all the time. I love them. I get annoyed when we haven't got any, and we've just got the standard people ones. These little ones really good on my patients. And the owners have a good laugh. So we got both eggs out. She fully recovered. The eggs were infertile, and they usually are. It's very rare to get fertile eggs in an animal that needs a Caesar. She made a full recovery, and her owner wants to keep her as a pet, so he's changed her husbandry in ways that reduces the chances of her ovulating again. So he doesn't want her to breed again. Okay, little furries. Okay, this is our patient. Okay, this was a lump that came in with a rat attached to it. Okay, this is Star. She's a 2-year-old female rat, and she's got lumps that have sort of been coming up over the last month. And I'll tell you now, guys, when you say to your vet, it's only been, just this week, it's only happened just this week, we don't believe you. What Dr. House say? Everybody lies. Okay, so they've been there for several months, but had started growing more rapidly recently. And that's her rolled on a side, and we can show you all of the lumps that she had. And this is fortunately a very characteristic disease. This is a benign mammary adenoma in a female rat. If she was a mouse, it'd be malignant. It'd be an adenocarcinoma. But mice have malignant tumours, rats have benign tumours as a general rule. But she's got a lot of them. So what are we going to do? And so that takes you into one of the quandaries in veterinary medicine, in general, exotic pet medicine in particular. Should you actually treat that little guy? What about the animal's welfare? Maybe it's not in the animal's best interest to do treatment, but maybe it is. So you have to weigh it up and make your decisions. So the for and the against and some factors to think about. 2-year-old, she's actually only middle-aged. These guys will live for 4 to 6 years. So she's only a middle-aged rat, and she's got another couple of years in front of her if we can do this well. So, you know, she's not at the end of her use-by date. She's got a good appetite, you can see that. Those lumps aren't just mammary tumour. There's a lot of fat around them. Otherwise, she's very healthy, very bright, happy. She's just got these lumps all over her body. And her owners just simply adore her. They're not even Goths. Okay, arguments against it, there's a lot of lumps there. No way you're going to get all those lumps in one surgery. Well, you could, but you'd be a pathologist rather than a surgeon. So what we have to think about, we're going to have to be doing several surgeries, and each time we do that, we've got an increase in the anaesthetic and the surgical risk. So we've got to weigh this up very carefully. We've got to think about pain. Are we going to be inflicting pain on this animal? How are we going to manage that? And what about the cost? Well, things to think about. We've really done well with understanding anaesthesia, surgery, pain control. Last 20 years, it's just exploded out of the gates. We can manage it pretty well. And in fact, I'm a bit horrified sometimes when I take people, family and friends to the hospital and see the low level of pain relief that doctors use, because they're very worried about people becoming addicts. So, yeah, we're bad luck, aren't we? We just luck out right out there. I use opioids in these guys all the time. I try to keep away from the fentanyl because I had to have fentanyl once and I really liked it. So I don't want to put temptation in my way. But we can manage pain, and pain is something that we can definitely manage, so long as it's going to be short-term pain, with a fixed term. If it's going to be long-term pain going on forever and ever and ever, and it's never going to go away, that's a different beast. And that's something we think about, palliative care or euthanasia. But this should be short-term pain. We should be able to manage this fairly well. And the cost, I'm not an animal valuer. I can often tell people what animals cost, but I can't put a value on it. That's the owner's job. Financially, emotionally, only one of its kind in Australia, last thing my husband left me. Those aren't decisions I can make. That's the owner's decision to make. And I tell people vets have got 4 things to tell the owner. We have to tell them your diagnosis, we have to tell you the treatment or treatment options, we have to tell you the prognosis and the costs. And then we step back and let you make the decision, because we're not there to make the decision for you. We're there to provide you with the tools you need to be able to make that decision. So the owners decided, let's do surgery. So we actually did 3 surgeries on this little rat. Now, if you're squeamish, now's the time to close your eyes. Okay, that's just the results of 1 surgery. We took 2 lumps off in 1 hit. So those are 2 mammary tumours. Okay, you can open your eyes again now. Now, just because I saw this guy only 2 weeks ago, and I thought we should really put him into this presentation. A little fishy. It's a little fishy. It's a 2-year-old goldfish and owned by one of our students. And this has been going on for 3 months. She got a slap over the wrist for that one. What do you mean it's been going on for 3 months? Yeah, I know I'm a bad vet, aren't I? Yeah, you really are. You need to bring it in earlier. But anyway, that's the lump. Okay, and by comparison, that's the eyes on this little goldfish. So quite a big lump on it. And the weird thing was, and I could understand why she waited, none of the other fish in the tank were affected. And this lump would get bigger and bigger and bigger, and then a little pouch would develop and rupture, and then it get smaller and smaller and smaller and go away, and then come back again. So she's umming and ahhing as to what to do. This has been going for a couple of months. The other fish are okay. Let's anaesthetise and find out what it is. Let's get a biopsy. So this little fish here now is, wrong, sorry, we went too far. Go back, go back, go back. You don't want to go back. Oh, there it is. We put an anaesthetic agent, alfaxolone, into the water. The bubbles are from an air stone, just blowing in air into the water to keep it well oxygenated so this guy can breathe properly. And the anaesthetic drug is absorbed through the gills. Fishy goes to sleep. Fishy goes to sleep, we get him up and we collect a biopsy. We took 2 or 3 biopsies using a biopsy punch, and we're using the needle there to get the actual biopsy out of the tissue that we had punched it out of. And then once we had finished, got our biopsies, we didn't have to put sutures in because these guys, they don't bleed very much when you do surgery, and they heal very quickly, and they're 2 millimetre punches. So we just changed the water into fresh water with no anaesthetic drug in it, kept the air stone going, and he recovered over about 20 minutes. Full recovery, and went home. And we sent the tissues off to a pathologist, and it came back as a rare type of virus. It's seen in goldfish, and it's not contagious. It doesn't spread from fish to fish, and it doesn't cause any harm to the fish that is infected. It just has a lump. So it's still got a lump, but now we know what it is. I sent the pathologist report off to the student and said, get your dictionary out and then tell me what it means. There were a lot of multi-syllable words in that report. Okay, what do I like doing about my job now? I teach, predominantly I teach. I do treat a lot of animals. I do clinics 3 days a week, but most of the time I'm teaching either via lectures or face-to-face teaching in practical classes or within the clinic itself, what we call WIL, Work Integrated Learning, which is basically practical work. So I get to engage with people from all around the world. You can see we've got students here. This guy was from Singapore. Singapore again, she was from Hong Kong, India, and that was another Singaporean guy. I meet a lot of Singaporeans. They're wonderful people. I love Singapore. I love the people there. And so I get to interact with these guys. And they teach me a bit about their culture, not realising that I forget 5 minutes after I've spoken to them. But they learn a few new jokes, and hopefully they develop a taste for avian and exotic vet medicine. So this makes the job really fulfilling. This young lady now is a vet down in Sydney. She's just had a baby. That sort of interrupted her study. She's well on track to pass her exams next year, I think, and she'll be a fellow of the college and be a specialist in bird medicine, and one that I've trained. So that makes me feel really good. So I get to do this 5 days a week, and some days you get tired. You know, Parkinson's doesn't fill you with energy. And by the end of the day, I'm getting a bit grumpy with the students, but not really, because they are fun to interact with and they're fun to deal with. And I learn a lot from them. Singaporeans, very good cooks. If you know anybody from Singapore, tell them Fridays is a good day to bring food. Equine Hospital has it as a tradition. They do a 6-week rotation and they have a feast at the end of it. I'm lucky if I get a chocolate slice. But I keep trying. So thank you all very much.
What an incredible tour of the veterinary world and some of the more exotic cases. I'm sure you have questions. We've already seen some coming through, so now is your chance to add them. If we could pop that QR code back up again. There was one question was, can we watch this talk again? You can. It is going to be up on YouTube within the next week or so, as are most of the past BrizScience talks. And of course, we will be back next month, so make sure you sign up to our mailing list or hit us up on X and Facebook and all those places. Next month, we are going to be searching for the biggest black holes in the universe. So make sure you join us for that one. All right, we've got some questions here. Are you up for them, Bob?
I am. There was a young fellow who put his hand up down at the back there.
All right, if you've got a question there, if you throw that in there and, put your name down as Bob's favourite, and we'll make sure that we grab you.
Yeah, I did see you put your hand up. I just couldn't answer it.
All right. So, we've got a question here from a couple of people have asked. Meng and Carolyn and a few others have asked about the lorikeet paralysis syndrome. And if you have any thoughts about it and recommendations for treatment. One of them is a wild bird carer.
Okay, the lorikeet paralysis syndrome we see in rainbow lorikeets up the eastern coast of Australia. Usually we see it seasonal in late summer, early autumn. And this year was a particularly bad year where clinics dealing with wildlife were seeing hundreds of these guys coming over. I've been told to speak into the microphone. Hundreds of these birds being presented to clinics every week. Even out of Gatton, we're out in the sticks a little bit, we were seeing about 10 a day. They come in paralysed in their legs and they either recover or they die, basically. And we've been trying to work out what the hell is going on here. Things that have been proposed, a friend of mine down in Sydney swears that it's lead poisoning, and he bases that on the fact that he lives in a part of Sydney, an old part of Sydney, where there's a lot of lead flashing on the roofs. So everybody's got lead poisoning. Why shouldn't these guys have it? We point out to him that wild lorikeets don't necessarily live in Sydney, and he doesn't believe that either. Another guy reckons it was a vitamin E deficiency due to eating too many unbalanced diets in people's backyards. Yeah, no. At one stage it was thought it might have been a virus, and that's still on the cards. The leading ideas at the moment is that it is a toxin, and it may well be botulism, which is a toxin produced by the bacteria Clostridia botulinum. And this toxin is, it's a pretty dangerous one. I mean, those of us old enough to remember quite a few years ago, there was an outbreak of botulism in 2 feedlots up on the Darling Downs, and they had 5,500 head of cattle die in a week. So it's a pretty nasty toxin. And I was told at that time that a teaspoon of this toxin put into London's water supply would have the Scots driving down to London to see why people aren't answering their phones. So it is a very dangerous poison. But we think these guys might be getting microdoses, and some animals will recover from botulism and others don't, and that may explain what we're seeing. But they were also finding high cadmium levels. And I said, well, what's cadmium and how did they get it? And nobody could answer that for me. So we're leaning at this stage towards it being botulism, but we don't really know for sure. We do know that with good supportive care, a lot of them will recover. But when you've got 1,000 in your hospital in a week, it's pretty hard to provide that level of care. And that was what the RSPCA found. They were absolutely flooded by them.
Amazing. All right, we got a question from Lay here who asks, do you pluck the feathers on the birds you operate on since they can't be shaved?
Yes, we have to pluck the feathers because they can't be shaved. God likes bird vets. He put a terralae, featherless tracts of skin, running lengthwise along the body. And so I try and go through those if I can. Because we have to weigh up, if we take too many feathers off, that's going to affect the animal's ability to keep itself warm. Those feathers act as a doona. So we take a lot of feathers off, we're going to have a cold bird on recovery and going through into recovery. So we minimise the amount of feathers. We can't pluck them, we can't shave them because they will grow only once they've been removed from the follicle. A new feather will come through. So it's not like our hair that continues to grow. Their feathers grow to a certain length, stop growing and then fall out and a new feather comes through. So if you've cut it off, it's going to wait until the next signal for a new feather to come through and push the stump of the old feather out. So yeah, we do have to pluck them. We just have to be careful that we pluck along the line of the feather. If you pluck against the feather or against the line of the feather, you risk tearing the skin because it's so thin. It's literally only a few cells thick, so we have to be very careful how we do it.
We've got so many questions here. A lot of them are very specific questions about animals you may or may not have treated. But I'm going to go for one here from Fletcher. Do spiny leaf insects get diseases?
I've never treated one, but I have some friends in Sydney and Melbourne who treat a lot of them. And they are much more popular pets down there than they are up in Brisbane. But there are certainly people who are treating leaf insects. And I once read a paper on how to take blood from a tarantula, but I haven't done that yet either. And it was green.
Johnny and, I'm sorry, I've lost them, but I've asked, Eva have asked, have you ever treated a frog or an axolotl?
Yes to both. Don't like treating them because they're very difficult. They're very complex in their housing requirements. Axolotls are a Mexican amphibian, and you would think, oh, well, you know, it's from Mexico, it must like hot water. Their origin is from very deep lakes, and they're actually an ice-cold animal. So in Queensland summer, you've got to put ice cubes into the water to keep them at the right temperature. So they can be difficult to manage and to do husbandry on. And when they get sick, it's usually because they've done something silly like people put gravel on the floor of the fish tank. And these guys are shovel feeders. They just motor along with their mouth open, pushing everything in. And eventually they get so many rocks in their stomach they can't swim anymore. And so you've got to work out a way to get those rocks out of there. Don't like frogs coming in because most of the frogs we see, nearly all of them are wild frogs. So you've got the stress of being brought into care combined with the stress of disease. They do fairly well if it's something fairly simple. And by something simple, I've taken legs off a few. So get run over by the wheelie bin, they've got an open fracture of the leg. we'll anaesthetise them just similarly in a similar fashion to doing that goldfish. And once they're anaesthetised, we'll take the leg off and then close them up, and we can pretty much release them within a couple of days. And they do fairly well. Animals don't care about what happened to them. They just get on with what's happening today. So they have no regrets about yesterday and no concern about tomorrow. Today's the day. I want to be an animal.
Boy, there's some life messages. Last two questions. First one from Andrew. Did you invent the beak straightening method?
I'd like to say yes and take all the credit, but a guy by the name of Brian Spear in Oakley, California, was the one who taught me. But I have taught other vets in Australia how to do it, because I brought it back, as I said, back in 2000 I learned how to do it. And I've twerked it a bit, made some improvements on it. So much so that Brian Spear, I published a paper on it, and Brian now uses that as a reference when he's training his residents. So I feel a bit flattered about that. And I think he actually does that because I put an acknowledgement at the end of it saying that he taught me how to do it. So he likes his residents to know.
I think everyone who has to wear braces as a kid now, we don't feel so bad. You could be a parrot. Last question, Bob, amalgamating a few here. What is your favourite animal to work on? And is there any animal you've always wanted to work on that you haven't yet?
Okay. The second one is much more difficult to answer because I've worked on so many different species. My favourite animal is the red-tailed black cockatoo. I adore them. They're much nicer than macaws. They are friendly, they're happy birds, they're very companionable. I'm really very fond of red-tails. Yellowtails, not so much. And you only have to look at their dietary habits. Red-tails eat predominantly vegetation. Yellowtails have no qualms about eating a mouse or another bird or a rat or a vet. They're just carnivorous, eat a bit of veggies on the side. But yeah, the red-tail is the sweetest parrot I know, and I've kept a wide range of birds, and red-tails are still my favourite. But I love the sound of all black cockatoos, yellowtails, red-tails, the white-tails, glossies and so forth. The only one that's weird is the gang-gang, because it sounds like two tree branches rubbing against each other. And sometimes you're walking through Canberra and you can hear the sound and you're not sure if it's the wind in the trees or is it a gang-gang near you. Animals that I've never worked on but would like to. I once would have said giraffe until a vet in Singapore told me that they can decapitate a lion with one kick. And I lost my interest in giraffes very quickly. I thought the lion at least is low and quick, and I'm neither of those. Haven't had the opportunity to work on. Some of the weird things I've done in America during my training, like working on chinchillas and little hamsters, little things like that, really cute, furry little things. They're a lot of fun. I'd like to be better at being a fish vet, but I think I've left that run too late. And all the fish vets I know are pathologists. There's one guy in Western Australia who was a clinician treating them. Everybody else is a pathologist. I had an argument with a pathologist once, so I said, it's all right for you, all of your patients are dead. I said, you don't have to keep them alive. And he looked at me and said, yeah, but all my clients are vets. So I just conceded that argument. I knew I'd lost. So yeah, I think there's so many things I've left unturned that I would like the chance to go and do, and I can't off the cuff think of anything in particular, but there probably would be.
Well, hey, expectations fulfilled. I mean, what a great way to win. Can everyone give a huge round of applause to incredible Professor Bob Donnelly.
Thank you, guys.
Very small token of appreciation from you two.
Thank you very much.
Thank you all so much. Please join us in the booth. We'll see you next month.